So that's what to be doing and seeing. As y'all may have seen, I sent the link out in the email. Breastfeeding is economical and healthy for the baby. So we're super excited to be able to have that here in Lexington now. So that was a really exciting thing today. We have several positions open at the health department. We're recruiting for an advanced practice provider. Oh, look, there we go. The pictures. All right, we're up and running. Thank you so much. Thank you, Alan. Yeah, so this is us this morning. There we are. So we did a ribbon cutting. There were some cupcakes. That's what it looked like, and it was just really, really nice. So lots of good things happening, and people actually came out in the rain, which was a little surprising. So great job, Michelle, to you and your team. Positions. All right, here's where we were. We are actually recruiting for 2 school nurses now because we had a resignation due to salary. The individual just needed a job that paid more, so we lost a school nurse, which was unfortunate. We're recruiting 2 nutritionists in WIC, and we have just put in to reclassify our full-time breastfeeding peer counselor to a part-time position. And the reason for that, Michelle and I have talked about it at great length, and we are just unable to recruit and retain a full-time person in that position. And we believe, based on conversations that we've had with, oh, if you ever have a part-time job, I'd really like it because I'm a young mom. And so we're going to give it a try with the part-time on that position to see if we can have better luck with that. And then social worker with the care management team. And we're still holding on a clinic nurse and an office support, but we should be posting that office support position soon. We have a rabies clinic coming up September 13th, and we're actually seeing an increase in COVID cases right now, but good news in the public health world, increase in cases, but staying the same in severity, which is how you want things like this. You know, illnesses go around all the time, and we expect to see things like that. But when we start really getting concerned is when we see an increase in severity. So we also expect a little bit more of a surge when we go back to school soon, when everybody gets back in to the grind with introducing themselves to new friends. That's when they start introducing new illnesses. Welcome back. On Monday, our Lexington City school nurses started back, which was great because Lexington City starts before Thomasville and Davidson County. So they're on a different calendar. So we saw those nurses on Monday, and in a couple of weeks, the other nurses will be here. We're continuing on with our community health needs data assessment, and then our health promotions team. It's very busy with back to school, and Randy's really excited to say that on-site is fully staffed and authorized in wastewater, which is the first time we've been able to say that in quite some time. So good job to Randy for your leadership. Thank you. And Trey, who is over there, is our program specialist, and we're going to be hearing a little bit more from him in a moment, but he's also on our on-site team. And I know that Trey and Randy are both excited that y'all are fully staffed because it definitely takes some of the pressure off. Mr. Chairman, or Acting Chairman, that is my report. If there's any questions, I'd be happy to take.
Any other questions from anyone? On to item 7, old business, the THC letter. We discussed this.
We did. And Belinda distributed a draft letter. What I'm going to tell y'all since we talked about this, the governor has set up a new task force advisory on cannabis, and the director for the North Carolina Association of Local Health Directors is actually on that task force. So we have an inside scoop on how things will be going with that. So I will be able to bring information back as it comes, but what it looks like now with the new letter is we changed to address the concerns that it's just lack of oversight and regulation. The first draft that we had was about, it looks like kids products, but after Jana and I did our undercover sting in the county, or whatever you'd like to call it, we found that there were not really those Skittles in Davidson County. But what we did find is that there are things that don't have any sort of government or medical oversight on it, so you don't know what you're ingesting. And the letter continues to talk about the importance of child poisoning associated with this. So my ask, I guess, for this board is, would you like us as staff to send the letter on behalf of the board to our local legislators? Or would you like to hold, or what would you like to do?
take a letter to local legislatures to make sure that they're aware of the issue. Accept it. I think it's a great idea. At least I think there should be guidelines in place that if you're going to carry products that could be targeted for kids just because of the appearance of the product, it should at least be behind the counter, behind glass. And they should be required to talk to the people that buy it and make sure that they understand the importance of keeping it away from kids. I just think there's things they could address. So. Anybody have any thoughts?
Certain age to go in those stores.
Only one of them that Jan and I went to said that you had to be a certain age. That was the one that, in layman's terms, seemed to be like the grade A establishment. The other ones were, I didn't care who you were, you could go, and the other ones were also the ones that had the vessels to hide and ingest, like to smoke them, that kind of look like children's things. So the grade A store, everything was behind a counter. That gentleman said you have to be 21 to buy anything here. But the other stores, anybody could go in.
And it's not only that, there was that the parents will buy it and take it home and leave it out where the kids can see it. I just think there needs to be some training that's required to say, hey, if you buy this, be sure you keep it out of reach of your kids, because these are gummies, so with my kid. I think they just need to be aware of it, so some regulations could be in place. Any other comments on it? Do you need a motion for that?
Yes, sir. If y'all would like me to send the letter that I've written, and I can, if you would like, if y'all would feel more comfortable, I can send it out to you once more, just to make sure everybody feels okay with it. And then prior to the next meeting, we can send it out. Based on what I'm hearing and not hearing today, it sounds like essentially it might be better just to say, we're concerned about the lack of regulation and the accessibility of children on these products. We recognize that there's a new advisory council on this, and we are just saying, as the Board of Health, we would like to see more information brought to lawmakers about regulation of this.
Do we have a motion to accept this recommendation?
I'll make a motion and just like I like her idea to send it out to the board members for review prior to sending it out.
That'll be fine. We have a second?
Second.
All those in favor, please? Anybody opposed? Motion carries. Okay, I guess on the new business. Mr. Mason is going to talk about program spotlight drones. You have the table.
Yeah, okay, there it is.
Well, that's your deal.
Yes, yes, please. There are some dramatic flicks.
Okay, well, let's make sure that we got the dramatic clicks done correctly.
All right. Hello, everybody. Trey Mason. I'm the program specialist for on-site wastewater here with Environmental Health. I've been with the department for almost 5 years now. Okay. Oh, too far. Too much.
Would you rather have the keyboard?
Is there a clicker? I'm good. I'm good. I'm good. All right. All right. So the title of this is a public health innovation, drone technology at the Davidson County Health Department. So the first question that I've always been asked is why this program? Why do we need drones? How have they helped us? What can we do? And there's already immediately, we've had a list of things that you can see here can help us with emergency preparedness situations. One of the biggest things that we've seen immediate impact of is improving our inspection quality out in the field. If needed, we can assist other agencies in the county, whatever they may need that may be drone related. And as a result of this program, we've already had our on-site wastewater team has been able to reach new horizons, and I would almost argue become a leader amongst our neighbors and peers in terms of having this program. So, but in order to get to where we're at now, which is quite literally off the ground, first we had to get approval for the program. So thank you to our administration for helping us along the way there. Then once we had that checked off, then we had to educate our staff members in order to operate a drone. There's a couple different ways that you can go about getting authorization or licensure to be able to fly them legally. We opted to go with the Part 107 license, which is a federally regulated license. And first we were able to send some of our staff members to actual course. So that way they would have a greater success rate in terms of completing that exam. Once you pass the exam, you actually get licensed via the the FAA. And then lastly, the drones do have to be registered with the FAA and actually have, as per the new legislation, You actually have to have, it's almost the equivalent of like a little license plate on the drone. And I don't have a zoomed in picture of it, but if you can see the belly of the drone, there's actually a series of numbers. It's actually pretty much like a drone license plate. That's in compliance with the FAA regulations. So meet the fleet. Currently, we have 7 DJI and Mavic Mini 3s. That is what we have currently. They're a small compact drone. They're way less than 250 grams. They are again, it's a very small drone, in which also in compliance with the regulations. We don't fly them during storms, during very cloudy, overcast days due to limitations and setbacks we have to follow. But that being said, the camera that's on these drones is very high quality. We're able to get good inspections, and later in this presentation, I'll share those with you guys so you can kind of see a few of the things we've done and accomplished so far. All right, so meet our team. Currently with on-site wastewater environmental health, we have 7 team members. And currently 3 of those are Part 107 licensed. 1 of them is Part 107 trained, not yet licensed, and the other 3 members are currently awaiting training. So with our inspections, we've been doing this for decades, and over the years, you can see generally a trend of improving quality of the inspections that we've done. Some of them have very little information, and we sometimes joke and say it's just chicken scratch, just a box and a squiggle. That's how a lot of our old permits look. And I'll admit, I myself still make some of these. I contribute to the chicken scratch pile, but in that rate, if we zoom in on the map a little bit, we can see that I try to capture as much of the information and tell as much of the story as possible as it's happened that day. And to compound this, make it better, make it more evident, as my grad school advisor once said, you have to make the obvious evident. So we GPS locate everything that we do in the field, and which even doing the GPS location, it still doesn't tell the entire story. And you know how the phrase goes, a picture tells 1,000 words. So we're able to go from, so I messed it up. Yes. All right. So you have my hand drawn picture, you have our GPS located data, and then lastly, you have the drone aerial from the day of the installation. So you're able to capture it in that day, in that moment, the day the inspector was on site. And since we've started this program, we've had dozens of successful flights all over the county, in every corner, different regions, different soil types, different locations, different landscapes, all for the same goal of being able to tell the story of what happened that day. With better accuracy and being able to tell things that you can't always capture with the GPS unit, you can't always capture with a pin. So where do we go from here? As far as I'm concerned, we're at the very beginning of this, and again, with continued support and knowledge that we've been able to gain from talking with other counties and just kind of learning as we go along, what can we do? I think the first goal for us would be to continue getting our staff Part 107 licensed, to where we can have the whole team licensed in that. Then we've discussed potentially more advanced drones. What do I mean by that? Some of them have onboard software that even have LiDAR that we can actually shoot our own topographical maps, generate our own map layers for permitting process. Also, drone to map is an onboard software where so far, whenever we take a picture, that's all it is. It's just a high quality 4K picture. Our hopes is that whenever the drone takes the picture, it automatically georeferences and maps it on our software that we use now. And in doing that, you can also have, they call it geofences, where the drone will fly a grid and actually stitch together a map that we can use later in permitting. But without further ado, I just would like to give a very special thank you to Corinne and Lillian and Randy for helping, and everyone else. I couldn't add everybody to the list, but for being able to get our program to where it is and support us and believe in us to make this possible. But without further ado, does anybody have any questions for me?
I want you to know I advocated for fish fillets for everybody.
Yeah, yeah, and and a little backstory. I had gotten into flying drones several years ago, and I was able to take this picture on the right, actually whenever we were offshore fishing the Gulf Stream with a personal drone that I have. There's definitely neat stuff.
So with the new systems, these guys are telling me they can get in 1/10 of an inch
Yeah.
installing a system. Well, the drones, does it have a GPS capability to say this is where this line should be and this is where it is?
That is the goal, and some of the bigger, nicer ones that have the, I'm gonna say the more fancy software do. I don't know if it's necessarily surveyor accuracy, to be honest, I'm not sure. But I knew several of them because the drone knows where it is whenever it flies. Even ours have a GPS footprint that they leave behind to log flight data. But ours is not to the point that it's surveyor accurate. If you've ever seen some of the private companies that do have those drones actually deployed for septic installs, it almost looks like the drone's wearing, I'm gonna call it a backpack. There's like a node that's a GPS unit that makes the drone very accurate in terms of knowing exactly what it's looking at. And so I don't know necessarily about the 1/10 of an inch, but I honestly wouldn't see it outside of the realm of possibility.
You think that's something we'll invest in later down the road?
I'll advocate for it, but I would hope so. I think it's super cool.
Thank you very much.
Thanks, sir.
Just coincidental, I was looking at a video today about the power of drones, what can be done with them. I'm glad you brought it up today. I'm glad you guys were able to work with that. These people were working with firefighters and they can track the forest fire, you know, they're firefighters getting condemned by fires and such. There's just so much potential. This is great. Thank you.
Absolutely. Thank you.
Anybody else?
Adam, do you want this or you want me to click something?
If you don't mind, you can click.
Oh, what got me click?
Yeah. And I'm gonna be one of those annoying like teacher types and stand up. I have a hard time sitting down and talking. Oh, yeah. Okay, all right, that's all I need. Yeah. So, what did you think it was gonna flip over?
It does flip
Oh, really?
over.
Okay,
Don't lean up front.
that would have been,
Please don't. It is a hazard.
that would have been fun. So, Lillian asked me to, I know you are under an obligation to have a training a year. Is that how it works? And so you all have not, I guess this is, you're due for your training and a lot of you are, newer. So we thought it might be a good idea to just sort of do a really general background on, the basics of North Carolina public health agencies. Of course, we can dive into any, future trainings, we can dive into any kind of more in-depth into any topic that you're interested in, but I kind of wanted to just touch on nuts and bolts of, what the statutes do, how the agency is set up and so forth. Did you have anything you wanted to say before I launch in? Okay. So anyway, I'm Adam Jones. I don't know. I think I've met, or you all know who I am. I'm the county attorney. And I just wanted to point out, so this is a North Carolina General Statute book. And there's a whole chapter in this statute book, 130A, that deals with public health. And so it's a lot. We'll start at 406, page 469 and go all the way through page 1180. So that's all public health. Not all of it, deals with local public health, but you get a sense, a lot of material, a lot of topics. And the public health realm is certainly, pretty highly regulated in the sense that there's a lot of statutes that speak to this. And then even beyond the statutes, there's administrative code provisions that are, that are put together, that are done by the state. So anyway, this, as I was saying, the health departments are a creature of statute. So or actually the entire North Carolina public health system is a creature of statute. So it didn't exist really prior to the state legislature putting this in place. So you have, there's, and this is all stated specifically in the statute. This is what the health system is designed to do: preventing health risks, identifying and reducing health risks, detecting and investigating, preventing the spread of disease, promoting healthy lifestyles, promoting a safe and healthful environment, promoting the accessibility and availability of quality healthcare services in the private sector. So, that's obviously the private sector plays a big role. And then providing quality healthcare when it's not available, through private means. So we can move on to the next slide. Then, as you can see, well, per the statute, most of the public health activities are actually pushed down, from the state level onto the local level for, for the local health departments to perform. So I know it's, I don't want to read the entire thing, but you can see it's, there's informing, educating, enforcing laws and regulations, linking people, to linking people together to get the necessary healthcare, diagnosing, investigating health hazards, and so forth. So this, and these are 10. There's a list of 10 things that are specified in the statute that are specifically designated for local health departments to do. So, now the statute creates, there's actually multiple different ways that a county could decide, to provide, the local health services. So, well, what we do in Davidson County, we have a county health department, but, there are other options, including, for smaller counties that have smaller populations, you might have a multi-county health department that, that's sort of a more regional thing. Or you could have a consolidated human services agency. So you can imagine DSS and, and the health department being combined. And there are, I guess, a few counties that have combined DSS and health department. So, okay, I think we can move on from that slide. Okay, now the statute specifies, what the composition of the Board of Health will be. So, 3 members of the public at large, county commissioner, physician, dentist, optometrist, veterinarian, registered nurse, pharmacist, and engineer. So, really broad range of talents that are brought in, and of course, identifying somebody who can fill each of those roles is a challenge, right? Because it is very specific. We can move on to the next slide. So what are the qualifications to be on the board? You generally have to be a resident of the district. And then you're appointed to 3-year terms, and you can serve a maximum of 3 consecutive terms. And of course, if you're appointed to be, if you're the physician who's appointed, you have to still be a licensed physician. If you lose your license, you can no longer be that, fill that role on the board. Move on to the next slide. So what are your responsibilities as health board members? I don't know if when you start, there's not like training guide, I don't think. So, one of the important things to remember is that, when there are things that the board is voting on, board members they're actually required to vote on, on all matters. So you can't just sit out something because it's uncomfortable, or you don't want to, take a position on something. You have to vote unless you have an actual bona fide conflict of interest, such as generally we think of that as some kind of financial interest that you would gain from some Board of Health decision. And then, there's a statutory list of ways that board members can be removed from office. Nobody's going to ever do any of these things, so we don't have to talk about them, but I did want to list them. And, of course, you guys are going to get a copy of this presentation. So, you'll have this as a reference. after this, because you're probably just about to fall asleep now. You want to move on to the next one? Okay, how are the, the board, how is the board and health directors selected? The Board of Commissioners, certainly here in Davidson County, appoints the members. Generally, I guess we do provide some recommendation, like we provide recommended candidates, or do we even do that now?
We do not do that.
Okay, so we've stopped doing that now, okay. And the per the statute, and this may be a surprise to you, the Board of Commissioners could actually essentially dissolve the Board of Health as a separate entity, and the Board of Commissioners could take on the role as the Board of Health. So that's, we can.
May not be as surprising as you think.
Yeah, well, I mean, you tend to think of something like the Board of Health being, sort of this, a sense of permanence or whatever. But the Board of Commissioners can always, pull it back and, and decide they want to serve as the Board of Health. And then the Board of Health, this board selects the health director. All right. Okay, so what can the Board of Health do? What can it regulate? As we saw earlier, there's a list of 10 responsibilities that are listed in statute. The local, Board of Health is required to do. The Board of Health can adopt rules, that's sort of necessary to implement, these duties. And then there's room for discretion. So, the Board of Health can make additional rules that go, beyond what the state, specifies. As long as it's, promotes and protects public health, reasonable in light of the health issue addressed, and it doesn't violate, other applicable law, doesn't discriminate, other restrictions. Basically, as long as it's not, in conflict with some other statute or some other legal provision. So, other powers of the Board of Health. If you can charge fees for services, thank goodness, right? There are some types of services that you cannot charge for, but you can provide. You can charge fees for things like wastewater treatment program, public swimming pools, tattoo regulation, and drinking well permitting. Some fees are set by statute, or set by the state or federal program that provides the funding. So you lose some discretion there. And I'm correct that if you raise a fee, that the Board of Commissioners has to approve that, right?
Correct.
So,
This board approves our fees and then it goes to the commissioners also.
right, okay. Now, another role that this board might play is, so generally this board is serving what you would think of as a legislative function, sort of like, like the Board of Commissioners or, the state legislature. You're, adopting rules, acting on proposals. There are times that you will function, that you might function a little bit more like, sort of a court where you're adjudicating a dispute. So if there's somebody has a decision that goes against them, at the local board, I mean, the staff makes a decision that's adverse to them, the board might, have to have a hearing, to resolve the issue. And in that role, the board acts in a little bit more of a judicial role. And there's some kind of special rules that would apply in that situation. But if that happens, we'll cross that bridge when we come to it. Then the Board of Health does not have the authority to enter into its own contracts. That has to be done by the Board of Commissioners. Okay, I think we're just about to the end here. So, how's the Board of Health funded? Most of the funding comes through, federal and state funds. Am I correct in that?
Yes.
So so there's programs that are paid for, by the state or by the federal government. And the health department is, the boots on the ground. Then of course, importantly, where there's not funds supplied by the state or the federal government, the county has to appropriate funds. And county commissioners approve the health department budget, each year, and fiscal year, each year starts on July 1. So, so we're now fiscal year 2026. So we just went through a budget cycle. Can also get money from grants, as well as fees, which, Randy, you're familiar with that, with fees. So, I think that's the end. And am I correct, or are there any additional? Okay. All right. Thank you very much. I appreciate your attention.
Appreciate it. Thank you. I do have a question.
Yeah.
If I may, you said something about filling positions, certain requirements that must be met in order for somebody to be on the board. Is the board not able to go outside the county if they have a particular position they can't fill? Or do they have to be strictly by someone in the county that could end up being just, a county citizen?
Well, there is an exception. There are exceptions. Like if you can't find somebody in the county,
Okay.
you can go outside the county, but I don't know that, have in your experience, have we had to do that?
Davidson County does not, that I know of. With 170,000 residents, we're good. Pamlico County has a time. They have a real hard time finding engineers and veterinarians. So they've had people that have been on the board forever because they can't find other people that live there. Pamlico County is tiny, and I talked to that health director, and she has shared that. But we're good with the number of people we have here.
Okay.
Thank you so much.
Right.
Appreciate it. I definitely needed the refresher.
Yeah, me too.
Item C, local child mortality clean report. Ms. Collins, you have the floor.
I think you all got that in your packet, so I'm not gonna go over it unless you have questions, other than you will see this time and time again right now, because I'm learning. I have a training at the end of this month. It is changing over with general statute things, so I'm learning and you will learn as I learn. So if you have Q1, Q2, it will probably go back to yearly, but I'll learn at the end of the month and see. Does anyone have any questions about it? I put in there what most of our child fatalities were, what we still want to continue to do with our safe sleep. We still have babies that are co-sleeping, rollovers, just air exchange is not good if they're in the crux of the arm here on a recliner, things like that. So we are hitting the safe sleep hard and child fatality team county. We have combined, we're not a child protection team, child fatality team. They took away the child protection team, which is DSS led. We are now led in one group as of January of this year. And then July of this year, something else changed. So that's why you're getting Q1 and Q2 report.
Mary Lou, if I may just add for the purpose of the board, it's really upsetting how many co-sleeping deaths we continue to see in Davidson County. Some of them are associated with drug use, but some of them are not. And so we have done our best to find available funds when they are available to buy the pack and plays. We can get them for about $70 when they're on sale, and we have given them to first responders that go out into homes and see that there's not a safe sleep. And so they have an option to distribute that. We also have them here with our care management team that they're distributing them, but y'all, it's just, it's alarming to me that we are giving information to the hospitals are giving it out. WIC talks about safe sleep with the babies. Our care management team talks about safe sleep with babies. And we continue to review deaths where people put that baby in the bed with them and the baby does not wake up in the morning. And it is just incredibly sad. So we're doing our best, but it's just really hard. And then, of course, we're up against, no offense to anybody that this applies to, but granola moms who are like, oh, you need to sleep with your baby. It's the best thing in the world to do. You should have this. And then we're fighting that battle also. And, you know, I tell folks, I really hear you on that. And I'm glad that you think that's great, but too many babies are not waking up in the morning because people are rolling over on them. And so the mixed messaging that's out there, like, oh, it's really great for your baby to sleep with your baby. And then no, it's not because your baby can die. And so, it's really.
We're trying to be very tactful in
Yes.
how we present that as far as safe sleep. But we're working with law enforcement. They're helping a lot. And when they go out, they will go back out to that home with a pack and play. And we're working with the sheriff's department, Thomasville, all of them, Thomasville, Lexington, and Denton. They all have taken some pack and plays. So they have been the boots on the ground for some of this, that when they go in and see something, they come back and get one or let us know. We take it to their office to take it.
So are we able to keep up with demand? Are we providing enough?
So far, we've just, yeah, I think so. EMS, when they go out to calls, too, they can help and they'll take some out for us because they go to some overdose things and see, and they'll come and take some of that out as well. So far we're good. And this is not a program to have a pack and play at grandma's and pack and play at, you know, we try to we can't police it all the time, but we do try. So, even our partners that come in for meetings, if they have that, then, we'll say, and let us know, we'll try to help you out and get one too, if you see a situation, so.
You already approved budget in space.
As stated, our county commissioners review and approve all of the budgets in Davidson County government. So in March of each year, we present our requested budget to the board. They approve it. It goes to the county manager's office, who has to weed through, really make some tough decisions on a final proposal to the Board of Commissioners. Staff are very thrilled with how our budget turned out this year. Last year, when we were sitting here, we had some concerns with the environmental health budget, having some shortfalls. We worked closely with the county manager's office to get those remedied for this year. We were looking at about the same difference that we're looking just in environmental health last year that we're seeing across 9 different divisions. So they have some kind of, we refer to it as magic math. So they have magic math that they go in and account for potential vacancies, potential time off and things like that to really look at the salary and fringe and move that around. So overall, we are very happy with the final budget.
Corinne did make me aware of one budget line that we're already feeling the heat on, and it is August. So our contracted services for environmental health, which, hey, Trey and Randy are here, just the guys that do this. We have to pay for head removals and disposals when we have to do rabies testing, and we pay for that out of the contracted services line, and we're already having to move money because we've already spent $1,000 on that line this year. So it's quite expensive.
Head removals of the animals.
Correct, yes, no human hair. Got a Board of Health information, I would be hearing about that one, but yes, the suspected cases of rabies. So.
Any other comments? School health interview report.
Yeah, I don't think you got this in your packet. I just put something up brief for you to see numbers. We talk a lot about nurse encounters and, you know, sending them home versus sending them back into the classroom, which is where we want them to be. So I guess you can see with them being in the schools, it does make a difference in getting that seat time in the classroom. That's important with that. That's not all they do, but that was just a snapshot of some of the main types of things that you're looking at. When you're looking at identified health conditions, you're looking at the folks that have care plans, that have seizures, or it can be migraines, it can be diabetes, it can be, I mean, many things. Not something that's gonna be they don't care plan something that will resolve. But they do still have to take care of that. It's just not identified there. So there are some 2-week things that they're dealing with, 3-month things, but it's not captured in that. So this is a snapshot of school health and things that they do. A lot of these communications that you see there, a lot of those are medical offices. They do have to call doctor's offices and follow up on care plan types of things, medications, or some type of care that they're needing to receive there. Does anybody have any questions?
So I just understand this chart. There were 174 instances where a Davidson County school nurse reached out to a parent, staff, or medical office in the last school year.
Yes, yes.
Questions or comments? Thank you. Appreciate that.
And I will tell you, we did have contract nurses during some of this
Yeah,
time.
yeah.
And some of this data we did not receive because they didn't give some of that data back to us when we switched over.
Good point. The asterisk there should be, the contract nurses did not provide us all the information, even upon request, and we had no way to require it. So we do not have a complete picture of the Davidson County school system.
Yeah, and Lillian, the math part of my brain doesn't understand how 17% of 8,467 students get sent home, yet there's only 174 communications parents, right? Like that's something
That's not the
doesn't.
same communications. That's why, because
Yeah.
that's not calling somebody to come get your child.
That's not.
That's
that
not the
communication.
communication. This communication is, we see this in the care plan. What it doesn't, you know, say it's a diabetic
Yeah.
and they need this insulin, whatever, and it didn't make sense to the nurse or whoever they're trying to teach to take care of that child, then they're gonna question that doctor. So it's not necessarily, hey, come get your child.
It's
It
something a
could
little
be
bit,
anything,
yeah, probably more serious in nature than come get your child.
right? So not the same there.
Thank you. I guess this communicable disease report, foodborne illness and so forth by Ms. Parker.
Right. Okay. Oh. Did I go too far?
Yep.
Way too far. Okay.
Oh, slow down. And we can go through that fast. So this is the 2024 Communicable Disease Report. And just a reminder that the data does lag behind pretty much a whole year, just for case investigations and cleaning and reporting of numbers. And so I've broken them down into disease groups. So this first group you see here, really your more food borne issues or things like that. I've kind of tried to highlight the areas where we see increasing trends. You know, this is really a good reminder slide to wash your hands when you are cooking for others, and cross-contamination and keeping things clean. Go to the next slide if you want to. Here we've got our hepatitis counts for the county and healthcare acquired infections. We have seen a little bit of uptick in hepatitis B and chronic hepatitis C. You will go to the next slide. As far as respiratory and Vector-borne diseases, we did not see anything super concerning over the last couple of years, or any, real sharp changes and trends. Next, and then our sexually transmitted infections, nothing that jumped drastically, in the, as far as this reporting period, so. And these are percentages, sorry, I should have, prefaced that or put that on there. This is the percent of the population. This is not case counts.
It's percent, I don't think 7% of the population has HIV.
It's, sorry,
Right.
100,000 population.
Yeah.
Sorry, yes.
Is there any guess to why every one of those looks to be lower in 24 than they were in 23? Any reasoning?
We're doing a great job.
Yeah, public education is fabulous.
Go team.
Go team, we're making our efforts to educate, and we hope that we're, other organizations and healthcare providers, we're all educating, folks to have
It's
safe
neighboring-
practices.
Is the neighboring county seeing the same trend there?
It's a
Y'all
little
track that?
hodgepodge all over the place, honestly.
I expect what you're seeing, Joe, is a underreporting in 22 due to COVID, which caused a spike in numbers in 23.
Gotcha.
I would also
But-
add the caveat, you saw a spike during COVID because of people who were at home with nothing to do.
Yeah, yes, that's right.
We saw more STDs, I mean, we did. That those two combined created like people who were seeking healthcare and then people who had more free time on their hands.
And there's been a lot of push syphilis wise. We've had a huge syphilis push for education because we did have such a spike, and we had cross county even types of things where we were having to work with other counties. So I will say county to county, we would probably look similar, but we've had some gonorrhea issues across the county lines. Going up and down 85 and things like that we share. Yeah, I would say the push of the education out there with different populations of your county.
The state also worked a lot in this past year, I would say, with the syphilis campaign as well. Congenital syphilis has become a real problem in some areas. Fortunately, we haven't encountered any of that here in Davidson County, but they did quite a big campaign push around that recently. Okay, and then this is TB, active TB, and then vaccine preventable diseases. Again, this vaccine preventable will be something that we continue to watch as time goes on, and that we'll continue pushing lots of public education, the importance of immunizations, and see what happens. And then this is just kind of a snapshot. The state does, this is provisional data, of course, but year-to-date comparisons of where we're at in 2025 compared to the 3-year average, and then the percent change between 2025 and the 3-year average. And so I just highlighted the ones that were increasing. And so those will be areas that we continue to monitor more closely. And again, this is provisional data, so it may fluctuate a little bit once we get to the second quarter. And yeah.
I guess you've got the next item also.
Yeah.
Report.
So this is our 2024 to 2025 customer service report. We do customer satisfaction surveys are linked to in everybody's email. We also have physical surveys available for folks to fill out and complete. Overall, we had a very good feedback this past year. I think the lowest number we ended up there with was the hours of service being excellent, only got us an 82%. But everything else on the other ones, the 95, 96 and 95%, those were all excellent. And anything below that was in the yellow area. One thing that I was able to pull out from the satisfaction surveys this year that I thought was interesting is that a lot of folks, when they got to the comments, they said, I was here for environmental help. I don't need anything with the health department. So confusion kind of where folks are or what services, how that we're connected. And so that goes back to, I always am talking about branding and recognition in the community and getting folks to understand what public health does and that it is multiple facets and divisions. So we might look at how we can word that a little bit better in our survey to get more folks to give us some feedback.
Overall, from someone who's worked with the public my entire life, that is exceptional. Anything else? Next item is the grease trap pumping protocol.
I just wanted to touch base, all the counties around here with bigger cities, they have whole teams that take care of this stuff. And obviously, I don't think we need that in Davidson County. But what are we doing to check and make sure that grease traps are being pumped? Are we doing anything, checking records or anything?
I know absolutely nothing about it, so please help.
I'm sorry, I was just looking, I sent an email asking and I don't have anything great to report back from the email I asked. So, fortunately, Jason had my cell phone number and I got a little heads up, so I had like an hour. So what I was able to do is reach out to the A team over there with Stacy and Randy, who let me know that 18E, the North Carolina Administrative Code, does require that facilities that are on a septic tank and have a grease trap pump it once a year. So then my question was, how do we know when they're pumping it once a year? And it says that they're supposed to keep it on site. So we know that we have some room to grow. Our environmental health joke is we're running a marathon, and Randy and Stacy are just sort of ticking off miles as they go because we were sort of in disarray for some time. So this is one of the things that we'll put on the marathon of how we do it. Currently, for Stacy's program, when she's going in for the inspections of the permitted facilities. So if you think of a grease trap, let me back this up just a little bit and say, grease is generated when you're preparing food. And so the restaurants or daycares or nursing homes that are preparing food and creating grease that are on a septic tank would need the grease trap. Y'all ever smelled a stinky grease trap? Let me just tell you, it's worse than a septic system, I think, personally. It's pretty bad. If you work in a restaurant, yeah, it is. So they have to be pumped and maintained. We have an inspection program that we buy. It's a software system that we use in environmental health to do our inspections. And it currently does not have a way for us to indicate if we checked off annually if their septic system grease trap has been pumped. So that's something that we can talk with the company about and see if they can potentially add that on there. But they have to have a plan in place when we write them a permit on how they're going to manage this. So that is something that we do need to work on. My one email said Orange County has something, but to your point, that's a county that maybe we don't want to model because of the difference of just the demographics and things there. But that was one email response I got. But I guess we do have a requirement that is supposed to be done annually, and we need to be better about how we're documenting that.
What brought this up is the worst one I've ever seen was right here in Lexington. The restaurant owner was dipping out the grease trap into 5-gallon buckets and dumping it in the storm drain. We just happened to go by there this morning and it was pretty bad again, so.
Are they in the city or county?
In the city.
Chinese restaurant.
You remember it?
It happened before. And DEQ, I went out with DEQ.
Yeah.
So would we have any jurisdiction over the one in the city?
Not with 18E.
Yeah, so 18E wouldn't apply there. So that would be something different.
They're not all septic city.
Right, exactly.
Is it possible to run a restaurant for an entire year and not fill up the grease trap? Like,
Depends on your business. I mean, if you're not doing much, yes, but most of them, no, you're not gonna run the whole year, right?
Every 3 nights.
Yeah.
so what do? You dispose of the grease in a separate container and put it in a separate container or is this an automatic process that somehow?
Well, this is grease that is coming from dishes,
Yeah.
correct? I mean,
There's a tank in the
coming-
ground
Okay,
that holds the grease, lets the water go into the city sewer or the leach field, wherever the case may be.
the grease is lighter density or something and
Yeah.
somehow the water. Okay, I got you.
Now, other grease is disposed into it.
Yeah,
But there's no outlet for it. It has to be pumped, right?
Yeah.
Yes.
so if it overflows, it comes out the top.
Not necessarily. I mean, yes, technically it will, but a lot of times it'll go down the line and harden up. And so your neighbor may be the one who feels the effect from it versus your restaurant or whatever the case may be.
So I think based on what little bit I do know now, especially if we're talking about the cities too, I do need to find out from other organizations what they're doing. Perfect timing because Adam did a presentation today about the roles and responsibilities of a Board of Health. This Board of Health has rulemaking authority that would affect the cities and the counties if that's what you want to do within the jurisdiction of Davidson County. So this is exactly the type of things that a Board of Health would need to talk about. What issues are we seeing? What is the public health threat? And then what local rules or regulations do we need to identify to fix the public health concern? We did that about 7, 8 years ago with the local recreational water facilities rules. That was rules that this board identified a public health issue, and create a set of rules, and now your staff here at the health department enforces those rules. It doesn't apply to anywhere else but Davidson County, North Carolina. Other counties do have a program about this. Like I said, so far Orange is the one that I've gotten back, but we can do some research, and if you'd like, we can talk and then make sure that we're understanding exactly what the concerns are, and then I can find out what else is going on in North Carolina. We can bring it back for a more in-depth discussion when we have time at our next meeting.
Sounds good.
But Lillian, to be clear, there is a law in the books that says it's supposed to be pumped once a year, or
For
is that a
septic
permit?
systems, I'm not sure about the city.
In 18E, it says they should be pumped annually.
Okay, yeah.
I don't know what the city would say that. And who decides that for the city, do you know?
I only know the person that regulates the size, so maybe I can talk to her.
Okay.
It's Laura, so.
So we would need to talk to the city of Thomasville, the city of Lexington, and then also some of our restaurants are on Winston Sewer,
Right.
right?
I mean, Handy services did.
Andy,
too.
okay. That's them. And they could have all different rules.
But is it within the jurisdiction of the health department, jurisdiction is the right word, if they're on sewer system? Or are we just talking about septics? Because the number of restaurants is gonna be very, very, very different depending on answer them.
I think where I would have the best information is to find out what other, even if it's Orange County, what their public health concern is with it, and then back it up to this is the public health concern, and then we figure out how that applies here, so.
Just a question, I don't know anything about grease traps. Is this an above ground thing? Is it
No, sir, it's below ground.
Yeah, I just recall 2 decades ago going by a Chinese restaurant, the guy comes out in this huge 50-gallon drum, and he's got his bucket and he's got his scoop, and he takes out a couple scoops and goes back inside. I have no idea what he did with that. But
I hope you didn't eat there.
no, I did not. But okay, so they're below ground. So.
Yep.
Yeah, I guess we need to enter into closed session.
Yeah, we will need a motion to go into closed session.
We have a motion to go into closed session, please. Move. Dr. Hammer for Gibson, and a second, please.
Second.
Gibson. All approved?
Aye.
Any opposed? Carries this one.
So now Adam will report it.
Okay, so we're back in open session. The board had a closed session to discuss 2 personnel matters, just to report back on 2 personnel matters. That's it.
Thank you very much. Do we have a motion to adjourn? Motion to adjourn. Second,
Second.
all in favor?
Aye.
Opposed? Let's go on.
Thank you so much.
Thanks. Y'all.
Great job, Mr. Chairman. Got all the hot seat for that. It was gonna have to be you, Calvin didn't make it. It was almost.
Oh, really?
I know that Calvin was gonna make it.
Sure I can be here, but I'm gonna stick it in. Yes.
How about you guys?
I said, I don't know who drives the red truck for your company, but I see them every morning. They're working cars down my way, coming down. This morning they had a ladder on.
Going down there jumping that.
Really? Are they working on his pool still? Oh, are y'all doing the pool in the
It's
garage?
not pool, that's an outdoor oasis.
Oh, is that what it is? Got it. Well, I told him whenever it's
That's what the
finished, it'll be nice. Bye, y'all. Thank y'all so much for coming.
Wow.